For 2 weeks straight.
No case is the same.
Morning, afternoon, and night, the U.S. Marshals Service partnered up with the FDLE, local law enforcement agencies, hospitals, nonprofits, and community organizations to find missing and endangered children, most of whom don't want to be found.
He's 17 years old and there's not a trace of him.
And I got to go with them. The work starts here at Central Command. The FDLE and local law enforcement agencies get tips, gather info, run checks on leads, and send teams out to actually find the kids.
Sticky situation out there.
The deputies out in the field have to piece together a puzzle, but they have to find those puzzle pieces first. I went around with Deputy Kaylee Healy and Deputy Justin Bankert as they tried to figure out who knows what and who's seen who likes to go where. All this while trying to be aware of dangers they could encounter along the way.
He hangs out with a group of kids who are also known gang members.
One day, the marshals got a call about a 17-year-old who'd run away from his grandparents' house a couple weeks before.
Mom has an extensive criminal history, so does Dad. It's just a recipe for disaster.
He'd been suspended from school. Deputies knew he'd at least dabbled in drug use. Eventually, deputies were able to track down a working number for the boy.
You're not in trouble, but you are on our list of critically missing kids, so we just have to make sure that you're good and safe.
The teen knew the marshals were going to find him one way or another, so he agreed to meet up with them. But the work isn't done when you find the missing kid. They need care after, too.
If it's a child who's a runaway, usually there's reasons that they're running. What's going on at home? Is there significant violence? Is there child abuse?
Marie Martinez is the director of the Howard Phillips Center for Children and Families. They set up a hub so kids could have access to a shower or a bed, healthcare, mental and behavioral health counseling, career services, contact with DCF, you name it. The master's level licensed clinical physicians on staff are trauma informed and trained on how to get the kids to talk about what they've been going through and to realize when a situation might not be normal.
To be honest, a lot of kids come in and say, I'm fine. I'm not being taken advantage of. Why am I here? In the case of trafficking, many times what we view as a victim thinks that that's their boyfriend. And so they think that, why is someone trying to rescue them?
They say intervening now could make a difference for the rest of these kids' lives. Without it,
it's less likely those kids will ever get high education attainment. It's less likely they will have a high income. Those are career-related things, right? But they're more likely to attempt suicide, to be depressed. They're more likely to misuse substances.
The trouble is, the U.S. Marshals Service says about half the kids they find will wind up running away again. That doesn't deter the marshals, though.
Which sometimes takes recovering and a couple times for them to realize that we are there for them and they're not just a stat and we actually do care about them.
So far, the operation has resulted in 6 felony arrests. Investigators expect to file more charges soon. And any of the cases the marshal took on, they'll finish even though the operation has already ended. In studio, Marie Edinger, Fox 35 News.